Well, in addition to just counting the number of small capillaries under resting conditions, we also realized, as was briefly discussed in the first presentation, that although capillary density and the number of red cells in individual capillaries can be low under resting conditions, as soon as you start exercising or if blood flow increases due to an increase in metabolic demand, shown on the right, in a healthy individual with a healthy microvascular system and a healthy glycocalyx, if blood flow goes up, also, the number of blood perfused capillaries increases in proportion. So if blood flow goes up twofold, we see there's a twofold increase in the number of blood perfused capillaries and in the red cell content in these capillaries. This is an example of one of these studies. This again was done in diabetes study, comparing healthy young controls with older controls and type 2 diabetics. If you compare the number of blood perfused capillaries under resting conditions, which is set at 100%, or in response to a flow challenge, and in this study, the flow challenge was induced by a high glucose drink, looking at what happened 30 minutes after taking in the high glucose, and blood flow goes up, take the glucose to your tissues. Well, if that happens in a young, healthy control, you see together with the flow increase, there's about a 2 to 3-fold increase in the number of blood perfused capillaries. And this doesn't happen anymore in the older people and also doesn't happen in the type 2 diabetics. So although the older people had a normal level of blood perfused capillaries under resting conditions, as soon as they're being challenged and blood flow goes up, you see there's also there, in addition to the type 2 diabetics, an impairment in their ability to increase the number of blood perfused capillaries. Similarly, this is data from a cardiology study, and now we increase blood flow by using a drug called nitroglycerin. So that's a drug typically taken by cardiology patients when they have chest pain. Put a little pill of nitroglycerin under the tongue, blood flow goes up in the whole body, attempting to relieve the pain on the chest. If we do this in healthy individuals to see that when blood flow goes up, we see there is a proportional increase, 2-fold to 3-fold increase in the number of blood perfused capillaries. And then in the two cardiology groups, so the red curve is from cardiology patients with large vessel disease or large vessel occlusions. And the blue curve is from cardiology patients with so-called syndrome X with a microvascular problem causing the angina. Both patient groups do not show at all any increase in the number of blood perfused capillaries when blood flow goes up. Again, schematically, if we look at the effect of a blood flow change in a healthy individual, so going from the left at the low blood flow level to the right-hand side at the high blood flow level, and when blood flow goes up in the feeding vessels, velocity of red cells goes up from 80 microns per second to 120 microns per second, so a 50% increase in blood flow. We see that this blood flow increase is also accompanied by the numbers of blood perfused capillaries going up from 2 to 3, so it's also a 50% increase in the blood flow perfused capillaries when blood flow goes up. And as a result, if you look at the velocity of the red cells in the capillaries, although blood flow goes up 50%, but because of the 50% increase in the number of capillaries, see that the blood flow in the individual capillaries doesn't change much. So it was 100 at resting conditions and still 100 in the high flow conditions because the increase in blood flow is now distributed over a proportional increase in the number of capillaries. So blood flow stays constant and slow in the capillaries, even at high blood flow levels. That also gives enough time for the red cells to exchange all the nutrients and the oxygen to the tissues. While in contrast, if we look at what happens in an individual with a compromised microvascular system, we see not only the low flow situation already, there is a lower number of capillaries blood perfused, but also when blood flow goes up, in this case, blood flow goes up from 50 to 100 microns per second in the feeding vessel, there's no increase in the number of blood perfused capillaries. So there is only one capillary under resting conditions, and there's still one capillary where blood flow goes up. And as a result, because of the lack of increase in number of capillaries when blood flow goes up, the only thing that happens at the capillary level when blood flow goes up from 50 to 100 is that also the velocity of the red cells in these capillaries goes up twofold. So with increasing blood flow, in the absence of a proportional increase in the number of perfused capillaries, the only thing that changes is that the red cells will start flowing faster when blood flow goes up. And in effect, there's less time for the red cells to exchange the nutrients and oxygen in a microvascular system of a compromised individual when blood flow goes up. So blood flow goes up, but there's less time and less efficient exchange of nutrients in the capillary bed that doesn't increase the number of capillaries when blood flow goes up. Well, as a result, the proportional increase in the number of capillaries in healthy individuals is also called the recruitment capacity. So if we compare the recruitment capacity in healthy individuals, which is close to 100%, which means that if there's a twofold increase in blood flow, there's also a twofold increase in the number of blood perfused capillaries. We compare that with patients, like in sepsis patients or in COVID-19 patients, there is no recruitment capacity. Smaller number of capillaries, it doesn't change when blood flow goes up. And again, in terms of red cell velocities in the capillaries, consequence of that is that if you look at the healthy controls, so the green dots, this is the velocity of the red cells in the capillaries as a function of the velocity in the larger vessels. So in healthy individuals, then the blood flow in the larger vessels goes up, range between 50 and 150 microns per second. The blood flow velocity in the capillary stays pretty constant at 100 microns per second. Contrast in the patients that have no recruitment capacity, so there's a fixed low number of capillaries perfused all the time. In the patients, if blood flow increases from 50 to 150 microns per second, we see a proportional increase of red cell velocities in the capillaries. So it goes down when blood flow in the larger vessels goes down, and the velocity in the capillaries goes up in proportion to the velocity in the larger vessels when the blood flow increases. So the time that the red cells spend in the few capillaries that they have is very much depending on the level of blood flow. Now, if we take all these together, if we count the number of capillaries and we also measure the recruitment capacity of the capillary system and blood flow goes up, we can define a so-called dynamic capillary blood volume. Dynamic capillary blood volume not only measures the differences in the blood perfused capillaries under baseline conditions, but also multiplies that with the recruitment capacity. So if we go from left to right, just counting the number of capillaries already shows a drop in the number of capillaries in the patient group. Taking the recruitment capacity into account makes it much easier and much more sensitive to see differences in the dynamic capillary blood volume in healthy controls compared to people with a compromised microvascular system.